for tuning in to our WMAR2 News Facebook Live discussion. Today, we are talking about hospice and palliative care. I know this is a topic a lot of people want to think about, much less talk about, but it is an important discussion to have with your loved ones, especially as they start to get towards the end of life. So joining us this morning to talk about all of this is Dr. W. Anthony Riley. He is the Chief Medical Officer at Gilchrist. So Dr. Riley, thank you so much for joining us this morning.
Thank you, Megan. It's my pleasure to be here. Obviously, I'm enthusiastic about hospice, although it is such a difficult subject to consider.
Absolutely. And we just want to remind people as they're joining the discussion, if you have a question for Dr. Riley, please leave it in the comment section and we'll be sure to get to it as soon as we see it. So I guess, Dr. Riley, why don't we just start off with kind of going over what hospice and palliative care is. I'm sure when people hear the word hospice, all kinds of different things probably come to their mind. So if you could just kind of walk us through exactly what it means when someone goes into hospice and palliative care.
Sure. So hospice is a very generous, comprehensive set of services that are covered by insurance. And it is different than palliative care because hospice is reserved for those individuals for whom cure is no longer possible. So it is a service focused on the care of those approaching the end of life.
Very good. And what are some little known facts about hospice care that you think are important for people to know, especially as they have to make those kinds of decisions?
I think your viewers would be surprised by some of the things that we've learned. Hospice is now a medical specialty. Hospice and palliative medicine has a certification process, has training. There's specific research that's being done in this area. And some of the research is very interesting. And I think your audience would be surprised to learn that some of these studies have shown that patients who get early palliative and hospice care actually may live longer compared to those patients who don't have that. There are many studies now that have reinforced this in a number of diagnoses. So I'll bet your audience didn't know that. So that's a little known fact. There are some others.
Go ahead.
The other little known fact is how generous and comprehensive the hospice benefit is. And this is a difference from palliative. Hospice is very comprehensive, has multiple services enfolded within this set of services. It is the standard of care, and these services are designed to meet both the medical needs of the patient, which are as important as the psychosocial, spiritual, and emotional needs. Both of those go hand in hand with the hospice benefit. And I think the generous nature and the comprehensive nature is what I think many of your audience may not appreciate.
Absolutely. Yeah. And if we can kind of go back to that research, Dr. Riley, I'm curious to know what about it and what they found in that research that says that people who go into this type of care may actually live longer. It doesn't really seem to make sense to me, but yeah, if you could explain that a little bit.
Sure. This study was done a few years ago up at Massachusetts General Hospital with a Dr. Temmel and her colleagues. They studied this in cancer patients, and those that received early palliative care and hospice care actually lived longer. The theory behind this is there's two reasons for this probably. One is patients who have advancing and worsening disease, the benefits of the treatments diminish while the toxicities of the treatment remain the same. So by avoiding toxic medical treatments at this stage of intervention avoids the effect of shortening the person's life. So that's one reason, the medical decision making. And the other is that individuals who, and my heart goes out to anyone facing this kind of condition, you're faced with non-medical concerns and worries. depression sets in, anxiety sets in. And if you're not prone to either, you generally have a lot of worries. The use of hospice addresses those concerns as well, which helps build the patient's resilience and ability to cope with what's happening. So those two things, the avoidance of medical toxicities and the treatment of depression, anxiety, and worry, helps people live longer.
Very good. Yeah, and I think too, some people worry that if they have to choose hospice, if they're at that point, say with themselves or perhaps a loved one, that they're essentially giving up. That this is the end and time to I guess throw in the towel. But it doesn't have to be that way. And you kind of explained it there a little bit. That there are things that you can do to make the end of your life just as good as the rest of your life.
That is correct. And I hear the word giving up quite frequently. And when I hear that, my heart again goes out to these individuals because they're struggling with what's happening to them. They're aware of the fact that their disease is worsening. They're aware of the fact that this disease is taking a terrible toll on their family. And I think in our modern culture, we expect patients to fight. We laud patients who fight. And so I think that is the model. And yet, fighting against an illness that is worsening may not be the best course of action. So I think having the skilled professionals, that is the palliative and hospice team, talk with patients early allows them to understand that they're fighting for something different now. When cure is no longer possible, they're fighting for something different. And that something different, we want to fight with you to get, because it can be so profound. One of the things I've learned from my own patients and in my work with my hospice team is that when this happens, patients can actually feel better, even though they have this worsening disease. They feel better because their worries are less, because their anxieties are less. They feel better because they're talking about what's happening. Nothing is as challenging as being a patient, and I've had patients privately tell me this. I know what's happening to my body, they'll tell me, but I don't want to discourage my family. My family is so sad. Everyone has precious loved ones. Everyone, you and I have them, and we don't want to let them go. Hospice isn't about fighting that urge to keep a person here with us. It's about fighting for something different that will have the chance, hopefully, to have a better experience of what's happening. Hospice can't change what's happening, but it can change how you experience what's happening.
Absolutely. For anyone who's just joining us, good morning. We're talking to Dr. Anthony Riley. He's the Chief Medical Officer at Gilchrist. We're talking about hospice and palliative care right now. Very important discussion that we all need to have at some point in our lives. And, Dr. Riley, we've talked a lot about patients who are going through this process, but what about the family members too? What are some of the services at Gilchrist that you offer, to walk them through this? Because like you mentioned, they feel like they're letting go and they don't want to let go, but it sounds like there are things that you offer that can help the whole family, get through this in the best way possible, not just the patient.
Yes, that's a great question, because part of this generous, comprehensive set of services that's provided by hospice is social worker and chaplain, volunteers, bereavement services. These are all skilled professionals dedicated to helping the family do this. We help the family in that way, but also hospice is one of the few generous benefits that has aid services as part of the benefit. And imagine the relief that a caregiver gets knowing that they can get an hour a day of an aid to help them with the daily care of their loved one. We have volunteers. We have spectacular volunteers in the Gilchrist program. And these volunteers will come, perhaps not in the COVID setting, but they'll help out caregivers by giving them relief for a 2 or 3 hour break. it's very, very important for caregivers to take care of themselves, because this is hard and it is sad, but yet there are so many good things that can come of it if the full set of services are used and people address their anxieties and worries. So
Yeah,
there's a
definitely
bunch of
things.
services that help those caregivers.
Right. Yeah. And certainly things that people should be taking advantage of when they get to this point. Let's talk, Dr. Riley, about getting to this point and
Yes.
what do I have to know and what should I be thinking about to make this decision again, either for myself or for a loved one?
Yes, Megan, may I go back and make one other point? This is from the research. In a large Medicare study, they studied the impact of the death of a spouse on the on the longevity and survival of the surviving spouse.
Mhm.
And spouses that had a loved one who died with hospice actually lived longer than spouses who had a spouse who died without hospice. That's the profound effect that addressing these worries, these concerns, the sadness associated with this process, there can be survival and longevity benefits to even the spouse who gets hospice services. I was blown away when I read that study, but this is the kind of work that is helping us know more about what's happening as we manage this very difficult part of life better. And I'm sorry, I forgot your question.
Not a problem. Well, I think that's really interesting too. I mean, because you think about the stress that it can put on a loved one
Yeah.
when they have their significant other or family member going through this, and that in turn can make you sick and not help your
Yes.
mental and your physical health. So yeah, that is
Yes.
a very interesting point for sure.
Yes.
Talking about getting to this point, when you
Yes.
realize that you or a loved one, this is probably a path that you need to start considering. What are some of the things that people should be keeping in mind or to know when it's time to make this decision?
The usual answer comes from two perspectives. One is, what is the patient experiencing? If they're not feeling well, if they have this nagging concern that sometimes is um, um, validated by the doctor, that the disease is worsening. Patients know this. They're living with their bodies 24/7. And so the disease is worsening, they know it. And if they talk to their doctors about it, the doctor may also then begin to say, this might be the time to consider um, an informational visit from the palliative care team or even from the hospice team. Not that you're ready today, but that it may be something that's coming if you're feeling this way. For cancer, patients suffering with cancer, it's usually triggered by those scans that aren't quite improving. For our heart failure patients or our lung failure patients, it's when the hospitalizations, the benefit of being in the hospital is so abbreviated that they're right back into the same situation a few weeks later. So if there's a multiple hospitalizations, that's usually a sign that the disease is worsening and that they ought to consider whether that approach to their worsening disease is the approach for them. A little known fact about hospice is that most of the hospice is provided in the home, and that we have robust systems in place for caring for people in the home. So that if you're in this cycle of not feeling well, becoming anxious about your shortness of breath, calling 911 and going to the hospital, and then realizing that the hospital benefit isn't very long lived, that you're back in the same situation in a matter of weeks, you might think about calling for help from Gilchrist, for example, to help manage these symptoms in the home. Because remember, the stage of disease that people are in at this point is really beyond cure. So if we could manage those symptoms at home, who wouldn't want that and avoid the trip to the ED and into the hospital? So at Gilchrist, we have a 24/7 nurse helpline that allows people to call with the slightest worry. I know from having talked to some of my patients, they don't want to call me at nighttime. They're afraid, I'm going to disturb the doctor. And they wait. And when they wait, they're even more anxious. And then they end up even more short of breath. And then they do call 911. Had they called, we might have been able to do something then and there before the cycle of anxiety and worsening symptoms occurred. So we have a 24-hour, 7 days a week nurse helpline. We also have nurses who will go to the home. If you're enrolled in hospice, they will go to the home at 2 a.m. when you're having these distressing change of condition, and to help work you through that symptom at that time. The docs are available by phone. We can do televisits. There's lots of things nowadays to help people stay in the home and not need to go to the hospital. Because I think many patients and families learn that, yes, the hospital can help me today, but the benefit is not very durable. And I've really taken on a lot of burden when I'm now in the hospital again. And if I could do it a different way, I want to explore that.
Yeah, and I would imagine too, it kind of goes back to earlier that research you were talking about people who are in hospice palliative care who live longer. I mean, being in your home, there's nothing more comforting than being in your home with your things, surrounded by your loved ones. I imagine
Yes.
that only can help you, make this transition a lot easier.
Yes. Yes. It really does help. And my hope for today is that by talking about this in this way, people will not have so much hesitancy to reach out, because we will send expert people. The doctors and the nurses are very good at prognostication and at determining whether this is the right time for hospice. If it isn't the right time, we will say so, but we will also offer insight into how you can proceed, even though you might not be eligible for hospice at this moment in time.
Good. And just a quick shout out to the doctors and the nurses, especially at Gilchrist, for all that they do for these families, because no matter how we talk about it, this is still a very difficult time. So I just want to give them props because, they are fantastic. And I know having someone to hold your hand through that has got to be instrumental in making this process easier.
I also want to emphasize our bereavement team. Our bereavement sees families, and I learn an awful lot from what the bereavement team says, because they learn from families about their experience, what worked, what didn't, what they were experiencing. And it's very sad to me that one of the things we learn when they talk in bereavement is that families will say, I wish I had known about hospice earlier. And had they known, they might have benefited a little bit more. The sad reality is that of the 3.2 million Medicare patients who die each year, only about half receive hospice services. And about half of those patients that get hospice services have it for only 18 days. And the hospice benefit under Medicare is 180 days. Hospice is this generous, comprehensive benefit that people are entitled to, and they're entitled to 180 days of it. And yet, on the national average, it's about 18 that people experience. And from my point of view, it's kind of sad because we can't do a lot in 18 days. We try, and we're, valiant in our efforts. But if we had a longer time, I think the experience could be better and the impact could be better as well.
Sure. Wow. So yeah, I mean, maybe it's just about changing our perception about hospice and what it entails and what it means. And like you said, kind of trying to make it, the best and the most positive way that we can to give this person a great end of life, just like they've had, all the days that they've been living as well.
I feel for patients because all of us are going to be in the same situation. And as I get older, I feel for them even more because I don't want to leave my loved one. I don't want to suffer. And yet I don't also want to be subjecting myself to the kinds of medical interventions that might divert my attention from all those non-medical needs that occur as a person approaches the end of life. And when I hear the words giving up, I sometimes think those patients who are choosing that medical route, they're giving up so many of these non-medical benefits, and that they need to weigh whether that is the best choice. Now, if a patient is a true warrior patient, they know what their choices are, they know who they are as people and who their family is, and they make that choice, we can support them through that. But in my experience in talking to many, many patients and families, most are not warriors. They're diplomats. They want to negotiate. They want to negotiate for more time and for help with these non-medical issues. And those diplomats, those negotiators, we work with them hand in glove to fight for those things that are most important to them.
It's all about quality, right? We want a good quality of life from start to finish.
Mm-hmm.
For sure.
Yeah.
All right. Well, Dr. Riley, is there anything else that you would like to discuss here as we start to wrap up our Facebook Live? Anything you think is important for our viewers to know about hospice and palliative care?
I think I've covered the points about hospice can prolong life when done well and done with a meaningful period of time. Hospice is a rich and comprehensive, generous benefit that's provided by Medicare and other commercial insurers. And hospice is designed by the scope of services to address the whole patient, both the medical issues as well as the non-medical issues.
Very good. And if people would like more information about Gilchrist, what's the easiest way to go about that?
To call, we have a care navigation center that is going to be able to pick up the phone. There's a website as well that can access. The website is up on the screen, I believe.
Yep.
We know that this is a hard call to make. And if you call us, we will strive and do our best to try to help you.
Wonderful. Well, Dr. Riley, thank you so much for taking the time and chatting with us this morning. And if you're just tuning in now and you missed the conversation, don't worry. We are going to post the entire discussion with Dr. Riley a little later on our Facebook page. But again, Dr. Riley, thank you so much for taking the time to talk to us today.
Thank you, Megan. It's my pleasure.